So I am delivering the keynote address for the American Association of Neuroscience Nurses annual conference this morning, and I'm just really excited and honored that they picked me to give their address. So as a neurosurgeon, I mean, one of the biggest group of people that we collaborate with in the hospital, in our office, are of course all of our nurses. And in healthcare, in order to have the best patient outcomes, you have to have a collaborative team for good communication. And one of the things that I talk a lot about on my platform, how we can do better in healthcare, because I think one of the things that we really struggle with is that type of thing. Communication in a good way, where everyone feels open and comfortable asking questions and doing all the things that we need to do to get the patient better. I think if you create an environment where people are scared or don't want to ask questions or feel some kind of way about asking for help, it just creates a situation that's obviously stressful. It generates a sensation of burnout. So my talk today is about kind of like all of those topics, my journey to why I went into medicine, why I went into neurosurgery, which has a lot to do with personal experience and my mom's situation. She was injured in the line of duty when I was young and suffered a spinal cord injury, and just all the nurses, all the healthcare professionals that took care of her on that journey was just incredibly inspiring to me to want to do the same for patients and to generate a sense of empathy and a sense of caring and compassion to the level that I think that you need whenever you're a patient or a patient's family member that's undergoing care for a devastating injury. And in neuroscience, like, the stakes are high. We're talking about the brain and the spinal cord. So you're talking about injuries like stroke, tumor, spinal cord injury, things that can really take a moment in a patient's life and completely transform every ounce of them, but like their family. And I think that's something that we often forget. We get so used to what we do every single day that we forget that every day of our life in healthcare is like the biggest day in a lot of people's lives. And I think sometimes we take that for granted and we take that out on our patient care. You have to continue to keep the patient at the center, like it's their first time doing this. So we have to explain things. We have to do the little things to make them feel special, to make their experience just the best, so they understand their injury and how to like kind of get through with the rest of their life after some type of life-altering event. And as physicians, we just believe that our day-to-day world is, you know, get in, get out, just move on to the next, and that type of, you know, behavior is just, it's easy to be complacent in. At least whenever I have a connection with a patient and whenever I can deliver care the way I feel that I would want it if I was a patient, it's incredibly meaningful. And in this just world of, you know, documentation, of insurance issues, of trying to see as many patients as possible, it creates just a sensation of burnout. Like, what is your purpose? Like, why am I here? It's not just to kind of get through as many patients as possible. My goal, why I went into medicine, is to take good care of people and to help people. And I think that that's just kind of faded out along the way. And it's easy to do because we're just so accustomed to our day-to-day life and trying to move on to the next step. We get to the next task, to the next procedure, so we can get done with our day. I think that we can do better, and we have to show others that it can be done. And one of the coolest moments for me was last night. One of the neuro nurses that trained me when I was a resident, she showed up, and it was just so special to me because I haven't seen her in over like 13 years. And she's the one that taught me these things. Do special things for patients. Be yourself. Do your thing. And, you know, it shows. And that's why we're in healthcare. So super excited about this talk. And thanks for listening to me ramble while I get ready.